If you've been treating your hip and it's still hurting, the problem may not be your hip at all. How can you tell if the pain is coming from your hip, your SI joint, or your lower back? It usually comes down to four things: where the pain starts, what movements make it worse, whether the pain stays in one area or travels, and what I find during the physical exam. The symptoms can overlap and even fool experienced clinicians. By the end of this video, you'll know how to tell the difference between hip pain, SI joint pain, and lower back pain by recognizing the signs and movement patterns that help to distinguish one from the other. Hi, I'm Dr. Whitney Wihlidal, a chiropractor in Orillia, Ontario with over 25 years of clinical experience in gait analysis, biomechanics, and neurology. This channel is for people dealing with chronic pain who want real step-by-step strategies that address and correct the root cause. If that sounds like you, subscribe below and tap the notification bell so you do not miss my weekly videos. True hip pain is usually felt deep in the groin or in the front of the hip. Some people also feel pain along the outside of the hip depending on the condition, but pain deep in the groin is one of the most common signs that the hip joint itself may be involved. Let me ask you something. If I asked you to point with your finger to the one area where your pain begins, where would you point? Would it be deep in the groin, in the front of the hip, or somewhere else? That answer is one of the first things I want to know because immediately starts to narrow the possibilities. True hip pain is usually made worse by movements that load or rotate the hip joint. Walking, standing for longer periods, climbing stairs, getting in and out of a car, putting on your shoes or crossing your legs, or turning your hip can all reproduce the pain because those movements place greater demand on the joint itself. Many people also notice stiffness after sitting for a while, especially during those first few steps after they stand up. The most common causes of true hip pain include degenerative hip arthritis, loss of normal joint mobility following a previous injury, repetitive wear over time, and other conditions affecting the hip joint itself. When I'm examining a patient, I don't stop at asking where it hurts. I want to see how the hip actually moves. I compare one side to the other and I gently rotate the hip, check the range of motion, and watch to see which movements reproduce the same pain that the patient's been describing. Patients with a true hip joint problem often have pain and stiffness when the hip is rotated inwards. And in many cases, that movement becomes limited long before the other hip movements do. Pain coming from the hip joint may spread into the front of the thigh, but it usually does not travel below the knee. If the pain regularly shoots into the calf or the foot, or you're noticing numbness or tingling, I start thinking beyond the hip joint and begin looking for another source of the problems. None of these findings by themselves make the diagnosis. We put the whole picture together using the history, the physical examination, and when needed, imaging such as x-rays to confirm whether the hip joint is actually responsible for your pain. Pain coming from the hip joint is only one possibility. Before you assume it's the hip, there's another joint that causes a lot of confusion because the pain can feel very similar, and that joint is the SI joint. This joint sits where the spine meets the pelvis and is one of the most commonly misunderstood sources of pain around the lower back and hip. One of the biggest frustrations I hear from patients is that they come into the office convinced that they have hip pain, and then I ask them to point with one finger to where it hurts, and they're pointing just below the belt line over the SI joint. That isn't the hip joint, and recognize that difference changes how I approach the rest of the examination. Try this yourself. Point with one finger to the spot where your pain usually starts. Are you pointing to the outside of your hip, or are you pointing to one small spot just below your belt line near the dimples of your lower back? That simple question often tells me where I need to focus my examination. SI joint pain is usually felt on one side and is often very localized. Many patients can place one finger directly over the painful spot. The pain may stay around the buttock area or it may spread into the back of the thigh. It can even reach the knee, but it does not usually travel below the knee. Walking, standing for long periods, climbing stairs, rolling over in bed, standing up after sitting, or standing on one leg commonly aggravate SI joint pain because each of those movements places stress across the joint. Sitting for longer periods can also increase symptoms for some people, especially when the joint is already irritated. Some people assume pain around the buttock automatically means it's the hip. During an exam, I see the opposite quite often. Once we identify that the pain is centered over the SI joint instead of the hip, the examination changes because I'm testing a completely different structure. The SI joint can be surprisingly painful, but pain location alone is never enough to make the diagnosis. I combine the history with specific SI joint tests and the rest of the physical exam before deciding whether the SI joint is the most likely source of the symptoms. But the SI joint isn't the only structure that can cause pain in this region. When the pain begins higher in the low back, I start looking much more closely at the lumbar spine. If your pain starts higher than the SI joint and closer to the center of your lower back, I'm no longer thinking primarily about the hip or the SI joint, and my attention shifts to the lumbar spine because this is another common source of pain that people often confuse with the SI joint. Mechanical low back pain is usually felt above the tailbone near the center of your lower back, although it can spread to the left or right. Some people point to one very specific spot, and others describe a broader area of aching across the lower back. Unlike true hip pain though, they are not pointing deep into the groin, and unlike SI joint pain, they're not usually pointing to one small spot just below the belt line. Think about where you're pointing to when your pain is at its worst. Are you pointing directly over the middle of your lower back, or are you pointing lower over the pelvis? That answer helps to guide where to begin the examination. Mechanical low back pain is commonly aggravated by bending forward, bending backwards, twisting, lifting, prolonged sitting, prolonged standing, and walking. These movements place stress on the joints, muscles, ligaments, and discs of the lumbar spine. The movement that consistently reproduces your familiar pain often tells me more than the pain location by itself. Sometimes the pain isn't confined to one small area when the surrounding tissues become irritated. The discomfort can spread enough that low back pain and SI joint pain start feeling surprisingly similar. And that is exactly why the physical exam becomes so important. During the exam, I carefully assess the lower lumbar spine for tenderness, stiffness, and how each segment moves. L5 is the level that is tender most often, although I also commonly find tenderness around L4 and sometimes L3. If pressing over those lower lumbar segments reproduces the same pain that you've been describing, and movements that load the lumbar spine make those symptoms worse, I begin thinking much more about the lumbar spine as the source. If those findings are absent and the pain instead is reproduced with SI joint provocation tests, my attention shifts back towards the SI joint. Mechanical low back pain usually stays around the lower back. It may spread into the buttock, but it does not typically travel below the knee. When pain shoots into the calf or foot, especially if it's accompanied by numbness or tingling or weakness, I begin thinking about irritation of a spinal nerve rather than mechanical low back pain. Once a spinal nerve becomes involved, the symptoms behave very differently. A disc bulge or disc herniation can place pressure on a spinal nerve, changing both the location of the pain and the symptoms experienced. Instead of remaining around the lower back, the pain often begins following the path of the irritated nerve. The spinal nerves most commonly involved are L5 followed by S1 and L4. When one of those nerves becomes irritated or compressed, the pain behaves very differently than typical hip pain, SI pain, or mechanical low back pain. Think back to when your symptoms first started. Did the pain begin in the lower back and then start traveling further down the leg over the next few days or weeks? Or has it stayed in the same place the entire time? Patients often describe nerve pain as sharp, burning, electric, or shooting. Instead of staying around the lower back, the pain can travel into the buttock, down the thigh, and into the calf, sometimes all the way to the foot. That pattern is what most people think of as true sciatica. And unlike mechanical low back pain, a disc injury can also produce numbness, tingling, muscle weakness, or changes in sensation along the path of the affected nerve. Many patients tell me they are comfortable in almost no position. Sitting may increase the pain, standing may increase the pain, walking may increase it, even coughing or sneezing can make the symptoms much worse because those activities increase pressure around the irritated nerve. One of the first things I notice when a patient walks into the room is their posture. Someone with an acute disc herniation often walks into the office leaning to one side or standing in a protective position because the body's trying to reduce pressure on the irritated nerve. That is very different from the way someone with hip arthritis or SI joint pain usually presents. Pain traveling below the knee is one of the biggest differences I look for during the examination, but it's not enough by itself to make the diagnosis. You also have to check muscle strength, reflexes, sensation, and specific nerve tension tests to determine whether spinal nerve is involved and which nerve is most likely affected. So let's pull everything together. If your pain is deep in the groin or in the front of the hip, becomes worse when walking, climbing stairs, or getting in and out of a car, or rotating your hip, and you notice stiffness or loss of hip motion, the hip joint moves much higher on my list. If your pain is located just below the belt line, usually on one side, and you can point to the one small painful spot with a single finger, especially if the pain spreads into the buttock or the back, of the thigh are usually not below the knee, I'm thinking much more about the SI joint. If your pain is centered higher in the lower back, becomes worse with bending or twisting or lifting, or prolonged sitting or standing, and you have tenderness over the lower lumbar spine, especially around L5, L4, L3, the lumbar spine becomes the leading suspect. And if the pain shoots below the knee or into the calf or foot, or it's accompanied by numbness, tingling, or weakness, and it's when I become much more concerned about irritation of the spinal nerve by a disc herniation. No single symptom or examination finding makes the diagnosis. We put the entire picture together by looking at your history, how your symptoms behave, the physical exam, and when appropriate, imaging such as X-rays or MRI. Looking at the whole picture is what helps us identify the most likely source of your pain and decide what to do next. Today we compared 4 common sources of pain that are often confused with one another. You learned how pain location, movement, referral patterns, and the physical exam help to distinguish between hip pain, SI pain, mechanical low back pain, and pinched spinal nerve. After watching this video, which description matched your symptoms the closest? Was it the hip pain section or the SI joint pain section? Drop a comment below and let me know. If you found value in this video, please give it a like and share it with someone dealing with hip pain, SI pain, lower back pain. Doing that helps more people find practical, non-surgical information that may help them move and feel better. And be sure to subscribe if you want real solutions for pain relief, better posture, and a clear understanding of what's causing your symptoms so you know exactly what to do next. Now, if you'd like to learn about one of the most common missed causes of hip pain, SI joint pain, lower back pain, watch this video next on leg length discrepancy. I'll show you how even a small difference in leg length can affect the way you walk, change the forces going through your spine and pelvis, and explain how we help patients identify and address this often overlooked contributor to pain. Go watch this video next.